Good afternoon. You are welcome to our today's class. Today we'll take a look at the course PHT 124, Substance Use and Abuse. Substance Use and Abuse. Okay, today we take a look at the topic drug and substance use, misuse and abuse. Drug and substance use, misuse and abuse. So as a word of introduction, the use of drugs and other psychoactive substances has actually existed throughout human history. People keep using psychoactive drugs that affect our psyche. They are used for medical purposes, for socio-cultural purposes, even recreational purposes. Now, actually, these drugs are actually beneficial, but when they are properly used, only when they are properly used. But if they are used inappropriately, it can result in serious health issues, psychological issues, and even social consequences. So another thing I want us to know is that if you understand the concept of drugs at the same time substance use, misuse, and abuse is very important for us in the health care sector, and even very important to any student of health sciences, which public health is one of them. Now, before we go into this topic, you need to understand what drug is. So let's look at the concept of drug. What is a drug? A drug is a substance that's, when used or when they find their way into our system, it has a way of, changing some physiological functions or the biological processes in the body. By way of definition, a drug is a chemical substance which can be synthetic or natural, that when introduced into the body, it alters the physiological functions or the biological processes, and it can be used for prevention, diagnosis, treatments, or management of diseases. This definition was given by the World Health Organization in 2022. So what we are saying in essence is that drug may alter physiological functions of our body when they find their way into our system. Drug may also affect mood, perception, consciousness, and even behavior. So let us understand that. Now, what can we see as drug? Examples, things like prescribed medication can be seen as drug. Anyway, alcohol, tobacco, opioids, and the stimulants. Now, what is substance use? What do we understand by the term substance use? Substance use refers to consumption of psychoactive substances such as medication, alcohol, tobacco, or even other drugs for medical use, social, cultural, or recreational purposes. So underline the word use, that is another point there, substance use. In substance use, when we use these substances, which drug is one of them, use them for the purpose of medical purpose, social purpose, cultural purpose, or even recreational purposes. We say that what the process is for, known as substance use. Now, what I want us to know here is that Substance use does not necessarily means imply harm. No. Substance use does not necessarily imply harm when drugs are taken appropriately under medical supervision or within socially acceptable limits. So if you use a substance within socially acceptable limits or even under medical supervision and is taken appropriately, it will cause no harm. That is according to the United Nations Office on Drugs and Crime 2023. Now, what am I talking about? For example, now, if you take a prescribed antibiotics according to the medical instruction, or take it in moderate medical use, something like analgesic, that is what we mean by substance use. So far is within acceptable limit and the under medical instruction is what we call substance use. Now, this will take us to substance misuse or drug misuse. Please note these words: use, misuse, abuse. They are not the same. Okay, so let's look at substance misuse or drug misuse. Drug misuse occurs when a drug is used in a manner that is different from prescribed or intended medical purposes. Maybe it was prescribed for you to use a particular drug in a direction on how to use a particular drug was given to you, or substance was used, and you go and use it in a different way, in a different direction that is not exactly the way you are going to use. It's called substance misuse. Please, let's understand that. In use, you use it the way it was you are asked to use it medically. But in misuse, maybe out of neglect, or maybe you forgot, or maybe you feel that you need to take it more, so it will have more effect, is misuse. So substance misuse occurs when a drug is used in a manner that is different from the prescribed or intended medical purpose. For example, now, if you take higher doses of a drug than the dose prescribed, it's misuse. Or if you use medication without a prescription, you just go to pharmacy and or even if, or maybe I don't know how any source you get the drug. That is, you actually want to treat a particular ailment, and that drug is meant to treat that ailment. But because that drug, that medicine is a prescription-only medicine, you just acquired it for God knows how, and you now use it without following the prescription. You are misusing the substance. Or maybe someone has a amoxicillin or antibiotic. You not do proper diagnosis. No prescription was given to you, or any substance at all. You must not be antibiotic. You now go and share, maybe your friend or your mom is using that drug. You now go and take some from this or her own without prescription. You are misusing the medicine. So if you share prescription drug, sharing prescription drug is a misuse. Yes. Then, if you use drug for unintended purposes, is also what? Misuse. So if you use drug for unintended purposes, it's a misuse. Yes. So I want us to understand that drug misuse often begins unintentionally, just as I said. You not intend to harm yourself. You just feel like let me just get some from my friend's food and take. Unintentionally, misuse a drug, it will start unintentional, but with time it may increase. It may increase the risk of dependence. You start depending on that drug, and before you know what's going on, it will lead to adverse health outcome. That is according to National Institute of Drug Abuse 2020. Okay, now let's continue. So now let's look at drug or substance abuse. Drug or substance abuse. Use, misuse, abuse. Please let us note the difference between each of them. Please let us note the difference between each of them. Among them, sorry. Now let's look at drug or substance abuse. Drug or substance abuse refers to the harmful or hazardous pattern of substance use. Harmful or hazardous pattern of substance use that leads to significant impairments, distress, or negative consequences, affecting an individual's physical health, mental health, social well-being, or even occupational functioning. That is according to American Psychiatric Association 2013. American Psychiatric Association 2013 says that drug or substance use abuse refers to the harmful or hazardous pattern of substance use that leads to significant impairment, distress, or negative consequences affecting an individual's physical health, mental well-being, and social relationship, or even occupational functioning. So, use of drug or substance that is hazardous, it refers to as what? Substance abuse. Substance abuse is commonly associated with loss of control over drug intake. The person cannot control it. The person cannot control it. It is also associated with continued use of the drug, even when the person is aware of the harmful consequences. That is the worst thing that can happen to you. You are aware that this thing is harming you, but you cannot do without it. The person continued using that particular substance despite harmful consequences, and the person is even aware of the harmful consequences. It is also associated with risky behaviors. You take unnecessary risks because you are not the person in charge of yourself. The substance is the one driving your decisions. So it's a very serious situation. It's a very serious and pathetic situation. Please don't find yourself in that situation. And it is also associated with development of dependence. In fact, the right word is addiction, not just dependence. Dependence is married. Addiction to that particular substance is a problem. So now let us look at the difference between each of them. In terms of their use, let's look at the difference between among use, misuse, and abuse. In terms of their meaning, use means proper or medically approved consumption of what? Substance. While misuse means incorrect or inappropriate use of a substance. Incorrect or inappropriate use of a substance. And abuse means harmful or excessive use. Harmful and excessive use. Use means proper and medically approved consumption and use of substance. Misuse means incorrect or inappropriate use. While abuse means harmful and excessive use. In terms of the outcome, for use, the outcome is usually safe when controlled. For misuse, the outcome, there's an increased health risk. Remember I said that in misuse, it starts small, unintentionally, until it graduates to what? Risky behaviors. While abuse, the outcome is physical, psychological, and social damage. The damage is too much. The damage is too much. Okay. So, in conclusion, we have agreed that drugs play an essential role in modern healthcare. So, despite the fact that it plays essential role in modern healthcare, if used improperly, so improper consumption can lead to serious health problems, even individual and in public health. So we need to understand and distinguish between the substance use, misuse, and abuse, and try as much as possible to know when you are doing any of them. Watch yourself closely. Know when you are. That time you keep taking paracetamol when you don't need it, you are misusing it. That time you keep taking antibiotic when any small thing, keep antibiotic, you are misusing it. Don't think that you are using antibiotic. No, you are not using antibiotic. You are misusing it. So know when you know the stage you are in. I'm talking to you now. The stage you are in now. Know the stage you are in now. Some of us are still at the use. Majority are in misuse, thinking that they are using. And most of our youths are in abuse level. So know the level you are in now and work on yourself before it is too late. Okay. So if you know the level, you distinguish this level, it will help us as healthcare professionals to design preventive strategies and to provide early intervention as well as promote responsible drug use within our society. So let us know that, okay? So now, that's where we'll stop for the topic. For the topic, drug and substance use, misuse, and abuse. If you have any question, please ask. If you have any question, please ask. If you have any question, please feel free to ask in our next lecture, or you can drop it. For those that watch this video, you can drop your questions on the comment section. On the comment section. Alright, thank you very much for your attention. God bless you.